National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, I'm Naturopathic Doctor Jonathan Beatty, a health expert here at nationalnutrition.ca. One of the common complaints I get in my office all the time is about something known as Restless Leg Syndrome. Now, this is a syndrome that affects people at night when they go to sleep, and basically their legs feel jumpy. They feel like they need to move them, like they need to stretch them, like they can't calm them down. And in severe cases, their legs will actually twitch and move on their own as the person's falling asleep. This will of course jar them awake and can cause what we call initiation insomnia, or trouble falling asleep, because every time you're about to fall asleep, your legs kick, thus waking you up. Now, there are a few theories as to why restless leg syndrome happens. The key thing here is it's a syndrome. What a syndrome is it's a collection of symptoms without an actual understood cause. And the real reason why restless leg syndrome is a syndrome is because there's actually probably multiple causation here. In about 20% of cases, we see some abnormalities or deficiencies in iron levels and dopamine levels. And then in other cases, we see deficiencies in things like magnesium and other nutrients. And so the real key here is trying to identify which particular nutrient deficiencies or neurotransmitter deficiencies you may have. And then by figuring that out, you can better target your therapies. So it's always a good idea to work with a knowledgeable healthcare practitioner, get yourself tested so you can identify, do you have a magnesium deficiency? Best test for that is through what we call erythrocyte magnesium or red blood cell magnesiums. It's better than testing just your serum magnesium because a reservoir of magnesium is going to last be found in your cells, and the serum magnesium is a lot less stable and it's a lot less indicative of a deficiency of the magnesium. Again, iron testing, you can get a full iron panel including your ferritin to understand if you have any level of iron deficiency, and then there's certain quizzes and other tests that you can get done to evaluate whether you possibly have a dopamine deficiency. Now, if you suspect iron or dopamine deficiencies, supplementing with tyrosine and phenylalanine have been shown to increase your body's ability to produce or manufacture dopamine to maintain adequate levels. And then of course, if you have an iron deficiency, supplementing with a good iron is going to be really important for helping to alleviate that deficiency. If you're using a tablet form iron, adding in some vitamin C can be very, very effective to help ensure adequate absorption of the iron, to reduce constipating effects that iron can have, or even better yet, go with some sort of soluble iron, like an iron solution or product like that, which is going to have a much higher absorption rate and a less likelihood of creating constipation. Then, if you suspect a magnesium deficiency, you're best to supplement with magnesium, and again, ideally supplementing with it about 30 minutes before you go to bed, because that's going to give you maximum blood concentrations of magnesium after you take it to correspond with when you're trying to go to sleep. The magnesium will allow the muscles to relax, prevent that restlessness that the muscles have, and that's going to allow you to fall asleep, not be woken up by the twitching, and you're going to help overcome your restless leg syndrome. Now, there are a few other causes behind restless leg syndrome that you'll need to get evaluated. So if the iron and dopamine isn't helping, if the magnesium's not helping, it's best to work with a healthcare practitioner to uncover the other reasons why you have the restless leg syndrome so you can get an appropriate treatment. So if you suffer from this condition, I really hope this video has helped you get a good night's sleep. Any questions or comments, please post them below. Subscribe to our YouTube channel, and last but not least, always remember, knowledge is health.